Hello everyone, it's Dr. Wilson here again with Phoenix Regen, and in today's video we're just going to have a brief video here where we go through a new paper. It's linked in the description down below, where we discuss the new findings that non-steroidal anti-inflammatory can in fact inhibit people's healing when they have short-term pain. In particular, this study looked at chronic, acute and chronic back pain, and they discovered that when they give people non-steroidal anti-inflammatories or NSAIDs, they tend to have a reduced neutrophil count, and as you inhibit neutrophils, you seem to also inhibit the resolution of the underlying cause of pain. So it seems like, yes, they're very good for short-term management, but as soon as you've crossed weeks to probably months, you're going to see that people actually inhibit healing and progression. So we may very well be holding back some of our patients from resolution of symptoms simply because we've been giving them early treatment and continuing it rather than stopping. Definitely something to keep in mind. Now, one of the reasons for this, as this paper shows, is that these drugs, they inhibit, in particular, they looked at S1000, A8 and A9 proteins, but we also can look at the role of even how non-steroidal anti-inflammatories will inhibit prostaglandin production, which, as we know, is a pain generator. It's generally speaking negative for the short term, but as we also know, it helps in recruiting of local stem cells, it helps in recruiting of local tissue for repair of injury. So I guess it makes some sense that if we use non-steroidal anti-inflammatory drugs over time, we're going to actually reduce our long-term outcomes. But this is something I haven't seen much written about before in a paper, so I thought it was very interesting just to draw your attention to it. So I hope you learned something new, hope this was useful for you, and follow along, see us in another video.